So today I'm sharing the story of one of my patients. Let's call him A. When A's mom brought him for a routine checkup, she told me, Doctor, he never said anything. I had no idea that one eye wasn't working. And that is the danger of amblyopia, the silent thief of sight in kids. In this video, I'll explain what amblyopia is, how it hides in plain sight, and what every parent needs to do before it's too late. So, what is amblyopia? It's not just a problem with the eye, it's a problem between eye and brain connection. In amblyopia, one eye doesn't send strong enough signals to the brain, and over time, the brain starts to ignore that one eye. It becomes lazy, not from the lack of effort, but from disuse. So, here are three most common causes. Firstly, the refractive amblyopia, where unequal power in the both eyes causes the eye with the higher power to go. First is the refractive amblyopia. Here, if the power is different in both the eyes, the eye with the higher power, if the child is not using the glasses, will become amblyopic. For example, if your child has one eye with a power of +4 and the other eye with the power of zero point 0.5. So, if the child is not using corrective glasses, there are chances that the eye with the power of +4 might end up in amblyopia. Same happens with the myopes, where the one eye has higher myopic correction, but the child is not wearing adequate glasses. So, -5 and -0.5, the eye with -5 can become amblyopic. Second is strabismic amblyopia, where the eyes are in misalignment because of the squint or crossed eyes. And third is the deprivation amblyopia because of the obstruction due to a cataract or a droopy eyelid for some reason. So, why is amblyopia dangerous? It's actually so dangerous because the window for correcting amblyopia is small. You miss it, and the vision loss can be permanent, mainly because of the brain plasticity, and it decreases as the age progresses. In fact, the worst part is amblyopia doesn't always have visible signs. In fact, most kids do not even complain. They don't know what clear binocular vision feels like. The stats say 1 in 20 children may have amblyopia, and most do not even know about it. It's like living a life in low resolution with only one eye truly working. So, how to spot it early? You can look for some warning signs in your child. Firstly, if they are squinting or covering one eye. Second, head tilting, a very important sign. If you see this, take your child to the eye specialist. Thirdly, poor depth perception. They are not able to judge the distance between the stairs and end up tripping or falling down frequently. And if you notice, their eyes are not moving together. Lastly, they have poor performance in sports or reading. It could also be a sign of poor vision. The only reliable way of finding out is early vision screening. In fact, I believe all children should have a full eye exam by the age of 3 and again before the school starts. So, how do we treat amblyopia? We can give glasses for unequal power. Eye patching of the stronger eye is usually done to force the brain to use the lazy eye. And there are some eye drops which can be used in the stronger eye for the same concept. However, there's a disclaimer. Never use any of these treatments without approval of a doctor, as you might end up causing more harm. Basically, earlier the treatment is started, the faster and more complete is the recovery. In A's case, just 6 months of patching helped him regain nearly perfect vision, but only because his mom caught it in time. As a mom and an eye doctor, I can't stress this enough. If your child hasn't had an eye exam by the age of 4, book one this week. And if you've noticed even one of these signs I shared, do not wait. Like, comment, and share this video if it helped you. Subscribe for weekly science based eye care tips for kids. Your child's vision is their future. Let's protect it together.